Frozen into cars, white girls of the north, file past one fire.
One of the more exciting events in a child's life is losing his first tooth. It starts as a wiggle until one day the tooth falls out and is carefully placed under his pillow for a safe investment. With the tooth now gone, the child keeps running his tongue over his gum as if the tooth will still be there. The child is actually experiencing phantom pains. These pains occur in several instances, and while losing teeth would be the most common, the most extreme is losing limbs. Lost limbs imitate the same sensation as lost teeth, often at a higher intensity. These lost limbs are called phantom limbs, a phrase coined by Silas Weir Mitchell in the late 1800s to describe the feeling that a missing limb is still present.
Though more commonly associated with amputees, a phantom limb can also be seen in those suffering from paralysis, as well as those born without limbs. First observed in amputees, the phantom limbs were thought to be a matter of damaged nerve endings. However, News Medical stated in their article on phantom limbs that as studies improved, it became clear that the source of phantom limbs and pains was in the human brain, particularly the somatosensory cortex. The somatosensory cortex is part of the brain that registers senses like touch and will respond accordingly. When the limb is amputated, the body adapts, but the brain does not. The information previously received from the limb is still located in the somatosensory cortex, and as it lacks new input to register, the nerve endings are interpreted as nonsense. In order to get the brain to adapt to the new conditions, the nerve endings send messages to the brain in the form of phantom sensations, often manifesting as pain.
Again, phantom limbs create the jarring sensation that the limb still exists. In the article Phantom Limbs Can Contort into Impossible Configurations, Mocha Stanley documented the work of Professor Lorimer Moseley of Oxford University and neuroscientist Peter Brugger. The studies reveal that most of those who suffer from phantom limbs have limited control of the limbs, whereas some have full control. Some patients who were observed felt as though their limb was too long or too short, and some were able to rotate and contort the limb to impossible and unnatural angles for a standard limb.
Some amputees make documentations of their own experiences. In her video discussing phantom limb sensations and pain with amputation, Christina Stevens, a video blogger who lost her foot last year, says that while lying in her bed under her covers, it feels like her foot is still completely there. Another video blogger, SPC Brian Wagner, lost his leg from the knee down in the war in Iraq. In his video, Treating Phantom Limb Pain with Mirror Therapy, he says the sensation is a burning, aching discomfort. Experiences with phantom limbs vary, and although they are almost always existent, two are usually never alike. Christina Stevens went on to describe her phantom limb as more of an annoyance, while Brian Wagner described the limb as chronic pain. Symptoms of phantom limbs differ, but some degree of pain is always experienced.
Those with phantom limbs describe the pain as chronic, burning, and aching sensations. Some have described feeling as if the limb has been twisted or bent in an uncomfortable or pinching position. As stated before, this pain is mostly the body's way of convincing the brain to readapt. The nerves relentlessly send alerts to the brain in the form of pain. The pain can be heightened due to anxiety and stress, both of which can peak after an amputation. An amputee from the United Kingdom lost his arms 20 years ago and is still experiencing chronic pain from the limb. While there is no immediate cure for the pain, the sensations rarely improve without treatment.
Jonathan Cole's article, Phantom Limb Pain, addresses how in early phantom limb cases the limbs were thought to be a matter of severed nerve endings. Amputees would have additional surgeries to remove the inflamed nerves, but this only worsened the phantom sensations. This led to the idea that phantom limbs had more to do with the brain than the lost limb itself. Various methods of therapeutic treatment are thought to have eased the chronic pain, such as hypnosis and acupuncture. Some of the phantom limbs were prescribed antidepressants, and others underwent spinal cord stimulation, an electrical pulse sent through the spine that obstructs the nerve impulses that causes pain.
While there is no definite cure for phantom limb sensations, Dr. Vilaner S. Ramachandran and Dr. Diane Roger Ramachandran developed the mirror box therapy. Lorimer Moseley's article, The Mirror Cure for Phantom Pain, describes the treatment as an optical illusion in which a patient places his phantom limb and his actual limb in a box side by side with a mirror between the two. The illusion is that, though merely a reflection, the brain interprets the reflection as the lost limb. Sessions are frequent and brief, but it is imperative to keep the treatments consistent so the effects of the treatment stick with the patient. This treatment is somewhat effective, as patients say it often provides temporary relief. The goal of the therapy is to eliminate the limb altogether. It is indeed a strenuous process, but the therapy has cured one patient of the phantom pains.
Ultimately, The future of those suffering from phantom limbs is promising, and though on its very way to a cure, the abnormality is still being studied and treated every day. As the popularity of mirror box therapy grows, advances are being made. A virtually realistic mirror box has been in use recently, in which the patient can simulate their phantom limb. The recent advances in the study of phantom limbs will only encourage future neurological explorations. Phantom limbs are just one of the many mysteries of the human brain, and they're certainly not the last.